Hi, everyone. Welcome to another Monday. We're talking about body contouring, and we've been talking about different ways to deal with creating a more svelte silhouette and dealing with unwanted pockets of fat and so forth in the last couple sessions that we've had. And today we're going to be talking about when surgery might be appropriate or when we might want to consider the more non-surgical options. So I'm hoping that Amanda can join us today. We're going to try our best. We're learning this platform, so be patient with us. Yeah, we're going to be talking about non-invasive options for body contouring, as well as the surgical options that people will often consider, such as liposuction. So, let's talk about who the ideal candidate is for CoolSculpting and some of the non-invasive options that we have out there. I would say that the ideal candidate is really within about 5 to 50 pounds of their goal weight, and they're really looking to create a better shape. They want to fit into some of their clothing that maybe isn't fitting quite as they want, and they don't really want any downtime. And what I mean by that is they don't want to undergo a procedure where they have to take time off of work, or they have to restrict themselves from activities. So that's where some of the non-invasive options are really wonderful. For example, we offer CoolSculpting at the clinic, and CoolSculpting is super easy. You were talking about a 45-minute treatment time for one cycle. You come in, you have the applicator applied, and then there's, a time when you can relax, use your laptop, watch some Netflix, and just enjoy your time with us. And when you leave, you don't really need to restrict your schedule or your lifestyle. So what I mean by that is you can go to the gym. In fact, I had CoolSculpting done and then went to the gym almost, an hour later. So it's pretty easy in that regard. We also offer options that might, give you some tightening and create some improvement in skin quality. So now with all of the technologies that have come on board, you can really get very close to some surgical results with very little downtime and certainly no anesthesia. The people that may want to consider surgery, I guess, would be those who've lost a significant amount of weight, like 100 pounds or more, where you've got a lot of skin laxity. And in those cases, no number of non-surgical options such as radiofrequency or other tightening technologies are really going to give you the tightening that you might want when you've had that kind of weight loss or that kind of skin laxity. And in that case, a surgical option would be, the most appropriate, as long as you're an appropriate candidate for anesthesia. And that's something that you would want to consider as a patient is, are you healthy enough to have surgery? Not everybody is, right? If you have significant heart disease or significant problems with your lungs, then undergoing anesthesia may not be the best option for you, just because the risk associated is a little bit too high. And so who would be the ideal candidate for surgery, I guess, is the reverse of that question. And I think really it's that person who has a lot of loose skin that requires surgical removal. And those people who are wanting a significant amount of fat reduction immediately, right? So that person who wants to see that fat loss within the next week or two, as opposed to waiting for about 3 months. Now, keep in mind that even with surgical interventions, there is a recovery period and there is some swelling. There are some compression garments that need to be worn. So although the silhouette change and the shape can improve fairly immediately, it does take some time to get back to, your pre-surgical sort of level of activity, and the swelling needs to go down. So the results do take, say, maybe about a month to 6 weeks to really be optimum. But if you're the kind of person who wants to an immediate result like that, then surgery might be the answer for you. With CoolSculpting, we do advise that you have 2 cycles or 2 sessions with us to get a really fantastic result. And as long as you're willing to wait about 3 months to see the end result, I think it's a great option. Now, the other options that we offer for body sculpting do actually give you some tightening, and that's one of the things that I love about Body Effects and also Morpheus 8 Body. You will get some improvement not only in the skin quality, and with Morpheus 8, because it's radiofrequency microneedling, you'll get some improvement in stretch marks and skin quality as well as tightening. With Body Effects, you can reduce areas of fat and get some tightening with them. And you'll actually tighten the skin. Now, is it going to be removing large amounts of skin? No, it's not. But you're going to get some significant tightening and improvement. So, those people who are within, 5 to 50 pounds of their end goal weight, they would be excellent candidates for something like that. And again, both those options don't really limit your lifestyle, which is just amazing and awesome to me, that you can create that kind of a change in your silhouette that's permanent, and not really have any downtime, or you can just kind of go along without skipping a beat. The things that patients share with us when they go through this decision-making process, when they consider surgery, a lot of times what they'll share with us is that they're not really wanting anesthesia, and they don't really want to go under the knife. They might be scared of some textural issues that can happen with liposuction, especially the older techniques where the cannula can create some textural issues. Or they're scared about scarring or potential side effects with some of the surgical options. So those are some of the things I would encourage people to consider when they're sort of weighing the pros and the cons of both options. So, I think the best thing to do when you're considering body sculpting, as with any aesthetic procedure, is really to have a consult with someone who's very knowledgeable about both options and who will give you a non-biased opinion, and just help you weigh the evidence and weigh the options so that you can make a good decision for yourself when choosing. There are so many studies that have shown that CoolSculpting is an effective intervention when used for body contouring. I mean, 8 million treatments done worldwide. I think that sort of speaks for itself. So many peer-reviewed published papers that show it works. And within our clinic, we've seen, some tremendous improvements for people. I think the key is to make sure that when your treatment is being mapped out, that you're being treated adequately, that you're really decreasing that fat pocket that you're wanting to sculpt an adequate amount. Oftentimes we find that people benefit from 2 cycles or 2 sessions with us to really get that wow result, in a 360 sort of result. And sometimes we'll also combine this with Body Effects, which is a radiofrequency tightening and fat reduction technology, to really create circumferential loss, meaning, when we're treating the arms, actually getting tightening at the same time as you're getting fat reduction. And speaking of arms, I think that's another consideration. Are you wanting scars? So many of the techniques that involve sculpting the arms through surgery require a scar that's fairly significant. And what my patients have told me is that they want to do, want to see an improved contour in their arms, in order to be able to wear clothing that they sort of shy away from because they're concerned about how their arms look. So if they're wanting to wear a tank top or something that shows their arms, the last thing that they want is a scar. So I think arms are actually a great area when you're looking at a non-invasive option, whether it be Body Effects or CoolSculpting or Morpheus 8 to get some really, even more tightening in that area. So things to think about when you're looking for body sculpting, body contouring options. Remember, both of these options, non-invasive or surgery, they are permanent. So it's not as if you're choosing a non-permanent versus permanent solution. Really what you want to look for is how quickly do you want to see the result, and how much do you want to remove? How healthy are you? Does your health allow for you to undergo a surgical intervention? Can you tolerate anesthesia? How much downtime do you want to have? Can you afford to take time away from work? Well, you need to take time away from work. I think it depends on what procedure you're considering in terms of that that aspect. And are you wanting to wear compression garments and so forth? Just the downtime part of it. Does your lifestyle allow for it? So I hope that was helpful to everyone, and that helps you weigh sort of the pros and cons between some of the non-invasive options out there, as well as surgical options. Feel free to message us or email us. You can always message us either through our social media platforms or through our website, and we'd be happy to either schedule you in for a consult or answer any questions you have. This has been a fun little segment for us on body contouring. Feel free to go back and check out our other videos on that, either on our YouTube video channel or on Facebook. And I'm looking forward to joining you next month when we'll have another series of 3 topics for us to discuss together.